Hi, I'm Janin Veach. I'm the Director of Development for Katz Abosch. I'm pleased to announce the visionary and entrepreneur, Jason Brooks.
Actually, it would probably be a surprise to most people for me to say that my goal has always been to be in a leadership position of a small to mid-sized medical device company. When I was an undergraduate, I was contemplating becoming a physician. I studied bioengineering with the purpose of going to medical school, with the purpose of becoming an inventor of medical technologies. I had an advisor in the bioengineering department by the name of Art Johnson, who was an inventor of medical technologies himself. And when I asked him for a letter of recommendation for medical school, he said, well, let's sit down and discuss why you want to go to medical school. And during that conversation, I realized that I wasn't really sure I wanted to go to medical school. And he opened my eyes to the opportunity to develop medical technologies as an engineer, not as a clinician. So I pursued the engineering path, going to graduate school at Johns Hopkins, working in the industry as a scientist, developing algorithms for pacemakers, defibrillators, really starting to understand how medical technology is developed. All the while, the long-term vision continued to be find myself in a leadership position in a medical device company. While I was doing all that, my business partner was developing a technology at Johns Hopkins. We got back together in 2012 to spin out the company that is VasoOptic. So it's kind of a somewhat tortuous path to get to the end goal of being in a position to lead a small medical device company. So we were introduced to the Able Foundation through a gentleman by the name of David Wise. David Wise is a consultant to the Able Foundation. He's an entrepreneur in the healthcare space himself. I was introduced to David Wise through our legal advisors at McDermott, Will & Emery, who had worked with David in his past entrepreneurial endeavors. And so David and I met. I essentially gave David the overview of what our company is, what we're doing. And he said, well, I'd like to introduce you to Bob Embry at the Able Foundation because I think that they would be interested in what you're doing. So we had the opportunity to present our pitch to the Able Foundation, which actually was not that great of a pitch. It was more of a, here's what we're doing and we're in search of funds, but we didn't really necessarily expect to receive funding from the Able Foundation at that time. I didn't get very far into my presentation before Bob stopped me and said, are you willing to move to Baltimore? And I said, of course. And he said, okay, go on. At the end of the presentation, Bob had very good questions about our technology and about our team, and at the end of the presentation, it seemed like they were interested in the vision of our company. Despite the fact that we're a pre-revenue company, we can have significant impact on Baltimore, both economically, from a jobs perspective, but also from a healthcare perspective. Baltimore, for example, has above average rates of diabetes, and the main product that we are developing is a retinal imager for early detection of a condition that causes blindness in diabetes patients. And so I think that Bob and the Able Foundation recognize the significant impact and the variety of ways that we can impact Baltimore through investment in our company. My goal as an individual in my career is to integrate science, technology, and the law to promote healthcare. And that comes from a passion for developing technology, but also from an understanding of the fact that technology needs to be developed under a legal and regulatory framework that promotes quality in order to ensure that the output that the technology produces has a meaningful impact on individuals from a healthcare perspective. So to have one without the other, in my view, is actually concerning from a patient's perspective, because if you're just developing technology without an understanding of the regulations and the need for quality systems, the technology can have really significant deleterious effects on the individual.